Hello everybody, my name is Kara Bates. I'm a certified medical assistant who has worked for an orthopedic surgeon before. We use steroid knee injections to help inflammation in the knee. Sometimes you walk, twist it, doesn't feel right. The steroid injection can give you some relief. Also in older patients, arthritis, it can help kind of calm that inflammation down as well and prolong you having to get a total knee replacement. So a lot of times the older patients will opt for a steroid injection for some relief from the pain. Also with younger patients, you can pair it with some PT. The injection usually helps the knee feel better and push you into physical therapy to get the knee healthy. So I'm just gonna set up the injection and show you how that works. I'm not gonna do an injection, but here we go. So first you're gonna start with your chuck pad. This is your sterile field. You're just gonna lay that flat on your surface, and then I'm gonna lay out 3 sterile 4x4s. So I will open those up and lay them out. Each thing will have something different on it for the person who is giving the injection. So the first one here, we're gonna put some iodine. You always want to ask the patient if they're allergic to iodine, betadine, shellfish, because if so, then you can't use this. You can use something called HipaCleanse. I don't have that, so I'm using iodine. I'm not allergic to iodine. So you're gonna put that on this first one, and it's gonna look something like that. And then the middle one, you're gonna put rubbing alcohol. This is what you use to clean the iodine off. And then on this last one, we are going to drop a Band-Aid on there. I can get the Band-Aid open, there we go. You don't really want to touch the Band-Aid if you can help it, so when I say drop, I literally mean drop. And then now we're going to draw up the injection. A 10 milliliter syringe is what we're using. When does that open on? Here we go. So you are going to use an 18 gauge needle to draw up the injection. So here's my 18 gauge. I'm going to put that on the end here. You always want to wipe your medicines down. So I've got lidocaine, which is a numbing medication that goes in with the steroid, and then dexamethasone, which is the steroid. That's what calms the inflammation down. So you wipe the top with your alcohol prep pad, and then you're going to take your cap off your needle. I always do lidocaine first. So I'm going to draw up 5 cc's of lidocaine, and then I'm going to do 5 cc's of the dexamethasone. We're going to put that cap back on there, and then we're going to take this cap off and put it in our biohazard bin. Then you're going to put a 22 gauge on the end of it. That's what you stick in the patient and inject them with. You want to use a smaller one. So I'm going to pop that cap and I'm going to lay it here. The mid-level doctor, they're going to be the ones that touch that, not me. So after you get it all set up, you're going to prep your patient. You are going to take the betadine, put it on the affected area. You don't ever want to pick it up and then put it back down, so you just go in circles. Clean the patient. The mid-level will come in, or the doctor, the nurse practitioner, physician assistant, any one of those. They'll take the alcohol, they'll clean off that iodine, and then they will inject. I'm not going to inject myself. You will then clean them up with the clean sterile 4x4, the dry one, and then you will put your Band-Aid on them. So that's basically it. It's very simple. You set it up, they come in, they do the injection, and then the patient's on their way. Thank you for watching my video, and I look forward to watching all of yours.